Welcome to Unraveling the Brain. I'm your host, Dr. Josh Mattson. Today we got a special interview. I'm actually not in it. It's Christine and Dr. Ashley, and they are going to be talking about sleep hygiene. They're going to be talking about ways to improve your speech in yourself and in your kids. I'm really excited for this one because it's two great minds, two great people coming together to help educate you guys on how to get better sleep, which is so important for the brain and body to heal, grow, and develop. Let's jump in and enjoy this episode.
All right. Hello. Happy afternoon.
Yes.
All right. So I brought you here today because I came across this fact, and I'm going to read it word for word. The American Academy of Pediatrics estimates that sleep problems affect 25 to 50% of children and 40% of adolescents. So I want to talk about that. Like, why is sleep so important? I want to talk about some sleep hygiene today.
Yeah.
And I just kind of want to pick your brain apart.
Yeah, especially going through new patient paperwork. How many times do we see families check that box of sleep issues, either past, present, or, dealing with it for long periods of time? It's an issue that we see in the office for sure.
And sleep is so important. It's important for development. It's important for our attention throughout the day. It's important for learning. Like, what can we tell the people about sleep? Like,
it's so hard because we want to figure out what is the root cause, right? What's going on with your child specifically as to why they're not sleeping. And what we see in the office is we see things like primitive reflexes play into sleep, right? Is their moral reflex creating a startle response in the middle of the night? Are they getting proper oxygen concentration, right? Are they waking up in the middle of the night because their body is starved from oxygen? Or is it glucose related, right? Is their blood sugar regular enough and stable enough to last them the whole night so that they aren't waking up in the middle of the night? Are they so stressed and have so much sympathetic tone that it's just hard for them to unwind at the end of the day and they just can't fall asleep? There's so many things that play into why a child isn't sleeping. And ultimately, though, do they just have like a proper bedtime routine? And it always comes back to the basic foundations of like, what do the few hours before bedtime look like for this child?
Yeah.
So I know like you talk a lot with families about that routine. So can you kind of share some like tidbits of knowledge for parents that they can kind of like glean on? Because I know like it's kind of overwhelming when you have a child that you're just wrapping your brain around. What can I do to help my child sleep? So
I would say a bedtime routine and everything regarding sleep, it starts in the morning. And the reason I say that is because our circadian rhythms really are a 24-hour cycle. So the more that we can like kind of tune into our circadian rhythms at the start of the day, so even beginning with seeing sunlight in the morning can be so beneficial. Thinking about like the hours leading up to sleep, we want to make sure that throughout the day, that kid has been getting exercise. They've been eating a well-balanced diet because we don't want them to wake up in the middle of the night hungry. Like you kind of talked about blood sugar. Like
absolutely.
That's exactly what we're focusing on with a well-balanced diet throughout the day. But then those hours before bedtime, let's kind of focus in on that. We got some just environmental things that we can think about in a child's room. So what is their lighting like? Like, do they have fluorescent lights, or is it a nice, calm light that's not going to... Yes, very warm. What's the temperature of the room? Like, is it really hot in the room, or is it a cooler temperature? Our bodies will prefer that colder temperature to really fall asleep. What else? Sounds like white noise. Pink noise is kind of a thing too. Like
I've never heard of pink noise.
So pink noise is like the nature sounds. White noise is like a fan, or people describe it as just like the sound of a refrigerator. but like pink noise is more of an ocean or rainforest
Yeah, those
kind
like
of sounds.
calming
Yes.
nature sounds. Okay.
So there are different sounds and frequencies that can help kind of put a kid into a peaceful state. Getting them into like their bedtime routine. So having the same routine every single day where you brush your teeth, you maybe have your child pick out their pajamas, kind of give them some participation in the bedtime routine. You do some of the rough play, like not right before bed, but do it 2 hours so they get that activity in. I kind of touched on that earlier, but there are so many different things, and I just want to encourage parents to really listen to what their child needs and incorporate a routine that works for them but is also the same Monday through Sunday. Like, you want to stay consistent with your bedtime routine because that helps, again, get your body into that restful state because that's what their body does before sleep. So it's kind of what their body knows at that point.
Yeah. And for all these parents listening, these same applications go for the parents too, right?
Oh, yeah. Oh, yeah.
We see so many kids in the office that are feeding off of parental energy too of, hey, mom and dad, they haven't been sleeping for a really long time. And then things just seem more chaotic because our body hasn't fully rested.
Oh, for
so
sure.
These applications definitely can go for everyone, right?
Yeah. And I would say the big thing, like, not just for kids, but like screen time too.
Yeah, we didn't even touch on that.
Yeah, staying off our phones, like as adults, but also for kids to stay off of their iPads. Don't play video games right before bed. That just kind of has high stimulation for the brain. To go from like that level to low stimulation can be a really hard transition for these kids. So it kind of really increases that bedtime time because the body needs more time to get into that restful state.
Yeah, absolutely. We think of like getting revved up for a game or something like that. You can't go to sleep right after that. It takes so much time for our body to be able to relax and increase our parasympathetic tone after that. Yeah. And a lot of these like high stimulation apps or video games, like you were saying, are just way too much for the brain right before bed, especially.
And even just like getting in a nice warm bath where you can then do just some like sensory stuff to get that body into a restful state. So like a warm bath, but then you think about like the towel and drying off, like you're giving the body some calming sensory input versus like video games or that rough play that I mentioned earlier. You can do like lotion on the skin before bed too, and just kind of give the body some deep pressure, or like the kids really benefit with deep pressure before bed too, because that can help get us into that parasympathetic state, which is so important for our body to get into that relaxing state for rest.
Yeah. I just want to echo what you're saying, especially for parents. Like, if you feel like your child isn't sleeping and your first jump is like, well, let's add a supplement. Well, let's like add this. Like, first focus on the basics, right? Like, because these are the foundational things that are going to set your kid up for success for the next day, for the week, for the school year, right?
Yeah.
So just building those habits along the way are so beneficial before we start adding things or...
Yeah. Like, what does your day-to-day routine look like? And even just asking the parents to paint a picture of what those few hours before bed look like, it really allows us, one, to see kind of what their day-to-day life looks like, but it also helps us like point out, hey, have you tried listening to music before bed? Or do you read books before bed? Do you kind of dim the lights? There are so many things that we can kind of encourage them to do to help their sleep routine, their sleep hygiene that aren't supplement related. But if the recommendations that we are kind of providing still aren't working,
what's the next step?
What are the supplements that we would go to?
Yeah, so that's a really great question. I personally never like just recommending a supplement before I've seen a child.
Mm-hmm.
And it depends so much on what's going on, right? Are they waking up in the middle of the night? Can they not fall asleep right off the get-go? There are so many encompassing factors that play into why a child isn't sleeping appropriately. Um, I know we touched on a few of the blood sugar dysregulation, right? Is their body burning up that fuel so quickly throughout the day that they're waking up in the middle of the night? Looking at their palate. Is their palate super narrow, meaning that they breathe through their mouth at night and their body's not getting appropriate oxygen throughout their whole system? So their cortisol drives up and their body's waking up in the middle of the night because they don't have that proper fuel. So those are just a few things that come to mind as a clinician of what's going on with kids' sleep. But it's kind of chicken or the egg too, right? We see so many kids from a neurological perspective then have sleep issues. Well, is it the neurological issues that are causing the sleep, or is the sleep causing the neurological issue?
Yeah.
That's a whole nother factor of, well, we want to kind of help heal both at the same time. But you'll see things like, okay, well, our brain has to go through a detox protocol at night. Like our lymphatic system will completely detox through specific brain waves that we have at night. But if we're not sleeping properly, well, our brain doesn't detox.
Yep.
Our blood-brain barrier is impacted from our sleep too, right? All these pandas kids that are complaining with viral or bacterial infections that are creating immune response. Well, that immune response is having a neurological response in our brain because our blood-brain barrier is weak. And those antibodies are crossing our blood-brain barrier because it's weak. Well, are they sleeping?
Yeah.
So there's so many factors that play in from a physiological perspective that tie into our sleep health and our sleep hygiene. So I would just really encourage parents, hey, let's work on the basics and then see additional providers and help them get to the root cause of what's going on with their sleep.
Yeah, I think you did a really good job like describing the just kind of the physiological response, but like even energy too, like asking about energy. I know actually in the clinic this week we have a little kid that he sleeps great at night, but then his energy through the day is like he's still tired. So like even just asking those questions too, like
the timing.
Yeah. Like is your kid getting enough of sleep, and is it good sleep?
Yes.
Because you kind of mentioned this, like there are different parts of our sleep cycle that help with detoxing our brain, kind of decreasing inflammation in our brain, helping fight any illness or inflammation in our brain. And so I just think like it's so important that we understand where their energy is during the day, and if that sleep that they're getting at night is actually benefiting them to their best, to the best.
Yeah. It's so important to get sleep. That's the bottom line of these kids. If they're having all of these developmental issues or behavioral issues or whatever it is it come down to, are they sleeping appropriately at night? Is it good quality, not just the hours, but is that quality of sleep efficient enough for their brain to take a rest, digest, and allow it to refresh and be fully awake the next day and have no sleepy cycles throughout the day where they're constantly napping or they're not able to focus.
Yeah, so just talking about like the sleep cycle in general. So a typical sleep cycle, we have 3 phases of sleep. So the first phase of sleep is just like very brief, and that's like the first 15 minutes that it takes to just get into a more deeper sleep. So that is like 5% of our sleep cycle. And if we aren't able to get into those other stages, so like stage 2, that kind of helps with just All of the stuff, the information that we learn throughout the day, it helps to sort that information in our brain. That's what stage 2 is for. Stage 3 is a really deep sleep, and that's when we get into the stage that helps to decrease inflammation, fight illness.
Yeah.
And that's when, if we don't get into stage 3 sleep, we are going to wake up feeling tired. Yeah. Like we will not feel well rested in the morning. And sometimes, like, it's really hard to transition into that stage 3 sleep just based on maybe what we did before sleep, or if we have too much caffeine. For adults, I know that's my problem, at least. Like, caffeine at the end of the day, like, I'm waking up multiple times in the night, and those are the days that I wake up more tired. And a lot of that is because I'm probably not getting a ton of time in that stage 3 sleep.
Yeah. Yeah, and that might not be caffeine an issue for kids.
No, not for kids.
But even fluids, right?
Yes.
They're waking up in the middle of the night if they are of age to wake up and feel that their body does need to go to the bathroom. Is that something? Do they need to cut out liquids later on in the night so that they're not waking up to constantly use the bathroom?
Yeah, for sure. And then the one other stage that I didn't mention is a REM sleep. And that's a very, very deep state. Our brain waves are actually functioning the same as like when we're awake. So that's kind of the stage that we're dreaming in. But our body bounces back through REM, stage 3, and stage 2 throughout a sleep cycle, which is about 90 minutes long. So we go through multiple sleep cycles a night, but if we aren't getting like up to 8 hours of sleep, we aren't hitting
nearly enough of those stages.
And that's for adults. Like, kids need so much more sleep.
Well, thank you so much for putting on this podcast, because I know you really wanted to talk about this, because we see it so much in the office, and it's so prevalent here. And we just want to encourage parents of giving the proper information and trying to dive a little bit deeper as to, okay, if they are following these patterns, well, what can they do next? And you're just a wealth of knowledge when it comes to making sure that parents have the appropriate routines and habits, and making the home just a really great place to start before adding in a bunch of other things. So thank you so much for just kind of breaking that down and helping parents understand, because sleep is so important. And
so important for everyone, for parents, for kids. But it is more than their environmental attributes to their sleep. It's digging deeper sometimes, and that's questioning where their energy levels are, if there's inflammation in their body that needs to be addressed first.
Finding a provider that can get to that root issue if you've tried all of these things. So important.
Yep.
Awesome.
Okay,
all right.
Thank you. Yeah. Don't forget to change your clocks too. Daylight savings time is coming up.